Rachel Boyack.
Thank you, Mr Speaker. Mr Speaker, Nelson Hospital has been in the news, and here's why people should care. Nelson Hospital is old, it's crumbling, and it desperately needs replacing. There aren't enough beds and patients can't get the care that they need. 2 years ago, the Labour government agreed a plan to rebuild Nelson Hospital. Last year, National cancelled that plan. They promised a new plan would be finalised by Christmas. Well, it's April and the joke's on us. Medical professionals told us that one large-scale acute services building is what is needed to deliver the best care to patients and to care for our growing and ageing population. But instead, Mr Speaker, National want to downgrade these plans to smaller buildings. But let me tell you, what is happening in Nelson is happening in many regions right across this country. Thanks to who? Thanks to the reckless choices that have been made by those guys over there. Now, Mr Speaker, Nelson Hospital has also been in the news because of the lack of care provided to patients, not on the part of the doctors and nurses who go to work every day and do their absolute best. It's about the cuts that National have put in place to our health system in Nelson. Mr Speaker, wait lists have absolutely blown out, with one blowing out to over 1,000 people. It is the worst it's ever been. A woman visited my office last week. She is suffering from severe anxiety because she was told by her GP she might have cancer, and she was referred to Nelson Hospital for a colonoscopy. 7 months later, she has not received her colonoscopy, and she feels her life is at risk. Mr Speaker, senior doctors are speaking out because patient safety is at risk. Nurses are speaking out because they are so frustrated with the lack of resources to do their jobs. And this is the state of the health system as a result of National's reckless choice to cut jobs and halt the recruitment of doctors and nurses in places like Nelson. My office has been absolutely inundated with phone calls and emails nearly every day from somebody in Nelson who can't get the care they need. They've been telling me recently they can't get their test results back, delaying treatment by weeks, sometimes months. A mother came to see us last week. Her daughter has renal failure and needs a kidney transplant. She might be a match. The mother had tests done in December, but still hasn't received the results. So her daughter is left in limbo, not knowing if her mother is a match for her desperately needed transplant. A woman with heart problems reached out to my office last week. She wore a cardiac monitor for a week in October last year, and she still hasn't received her results, further delaying her treatment. Mr Speaker, I've had members of my community tell me they have to put in Privacy Act requests to get their health records so that they can access the treatment they need and the care that they need. It is disgraceful, Mr Speaker. Furthermore, I have asked Nelson Marlborough Health for answers on all of these cases, and they have not even replied to my office on behalf of my constituents. That is a disgrace under this government. It never happened under the previous government, Mr Speaker. Now, on Gisborne Hospital, Mr Speaker, National is also doing similar things there, with dozens of senior doctors writing to the government asking for urgent action. They've told the Prime Minister that Gisborne Hospital is on the brink of collapse. The doctors have no idea what plan is in place to address the vacancies in that hospital. The situation is dire and they're not able to provide locals with the care they deserve. And in Dunedin, Mr Speaker, the government has been playing us off against each other, saying regions have to fight amongst themselves for the resources. Every region deserves a decent hospital, Mr Speaker, and I will stand up for Nelson and every regional hospital in this country. National need to stop the cuts and let hospitals hire the staff they need. They need to listen to the people on the ground, rebuild the Nelson Hospital like it was promised, and not continue to keep the business case languishing on the minister's desk. Thank you, Mr. Speaker.